Omicron is here and it's spreading fast. So where are we heading? Well, confirmed cases of Omicron are rising by the day, but there are many more below the radar. One leading scientist tracking COVID told us there are likely to be around 500 cases a day, and they're doubling every 3 to 4 days. Do the maths, and by Christmas there could be almost 30,000 cases of Omicron every day. And by the turn of the year, if the virus keeps spreading at such a high rate, daily cases are likely to be well past 100,000. That's the same exponential growth rate as the beginning of the first wave in March 2020, before we went into lockdown. So what could that mean for the NHS? Well, reports from South Africa suggest the variant is causing milder disease in people who've been vaccinated or who have immunity from a previous COVID infection. But these are hospital admissions across the country. They're up sharply in Gauteng, where Omicron took off first, but there's now even an uptick elsewhere as the virus spreads. Even if only a tiny proportion of infections lead to hospitalisations, with a big rise in cases, there can still be a large number of admissions. Here in the UK, we're told time and again that the booster jab is our best defence against Omicron.
We're going to be throwing everything at it in order to ensure that everyone eligible is offered that booster in, as I say, just over 2 months.
So what's happened to the booster rollout then? Well, not a lot. An average of 380,000 people a day are having one, and the numbers are only drifting upwards despite the call to arms. Just over 20 million adults have had the booster so far. There are 26 million to go, plus another 6 million who haven't even had their first 2 doses. The NHS says it will scale up the rollout in the coming weeks, with the government setting a target of all adults being invited to book a jab by the end of January. But those vaccinations won't happen until February. Immune protection won't be secured for a fortnight after that. And with the Welsh Government predicting the Omicron wave will reach a sharp peak by the end of January, boosters may well come too late for many.